Today in our 5-minute faculty development course, we will discuss feedback in medical education. When defining feedback, we will say that feedback is a reaction with information to an action or behavior. Of course, we can give information or constructive criticism to a learner. Feedback is best when it is both formative and constructive in nature. The most common pitfall here is in not distinguishing feedback from evaluation. Evaluation is in stating things like good job or well done. Evaluation may give some sense of boundaries, say in training a pet, good boy or bad dog. And it is also helpful for the medical learner in letting them know how they've done on a certain rotation. However, it is not formative in growth, as we will see. Let's look further at the distinction between feedback and evaluation. Evaluation is a helpful tool. We do need to give final grades at the end of a week or of a block. However, this is not feedback that actually gives a formative growth. That Timmy is doing well or that he passed or failed are examples of this. When we want actual feedback, we would say that Timmy has maybe improved on his efficiency over the course of this week, or perhaps it would be constructive criticism on how he could improve on his efficiency. Specific information to Timmy's actions and behaviors will actually give formative change for his education. Overall, we want to focus on providing specific and non-evaluative feedback. Now, let's look at different types of feedback in medical education. The first one would be brief, and in this we might give feedback on a certain instance of behavior. Perhaps we would discuss how a particular procedure went, perhaps a toenail removal or a laceration repair. These should be immediately after the task is completed or actually during the encounter. The next step would be in more formal feedback. This would usually be a scheduled time following an observation, and of course it should be interactive. This could be perhaps on a Feedback Friday type situation where we gather around the table and discuss things that are going well and things that can be improved, but specifically giving feedback on those items. The larger step would be in major feedback. These would of course be scheduled as well and in a formal setting. Again, they should be interactive, but should ultimately result in a plan for action, such as an individual educational plan. Before we move on to methods of feedback, let's further discuss the rationale. As before, in the pet analogy, evaluative statements can be helpful and formative. We use these for our pets, but we also use these for our children. These can give boundaries, but they are not usually formative in their behavior. Giving good feedback helps develop our learners much like our children. Nurturing environments where it is safe to receive and give constructive criticism is tantamount for this being an effective tool. Let's talk about our first method, being the desk method. The desk method is best in brief or occasionally informal settings. This will be in first describing the behavior, next in expressing feelings about the behavior and how it affected you as the attending or the patient. Next, we will give specific recommendations for how to handle a situation, and finally, discuss a consequence that may be a positive or negative consequence of a behavior change of the learner. Let's look at this further. In the desk method, first we might describe the behavior. We could tell the resident that you discussed the problems with the nurses in front of the patient, but did not discuss with the patient directly. The next part, we would express feelings about this. I might state that the situation felt awkward, and the patient likely felt left out from the situation. Next, we could suggest specific recommendations on including nursing and patients in the discussion and speaking appropriately to a language that all can understand. Finally, we could discuss a positive consequence of doing this team-based approach will be beneficial to nursing trust and patient trust. A second feedback method will be the SOAP method. This is best in more formal or major feedback sessions with a bit more time. First, there will be self-reflection, then will be objective feedback that the faculty delivers, then you will ask for learner understanding, and then make a plan for follow-up. Let's discuss this in more detail. Again, the SOAP method is best in more formal or major feedback sessions, likely longer than 5 to 10 minutes. First, with self-reflection, we might ask the learner, how do you feel about your performance? Are you meeting goals? Perhaps a question of, are there areas for you to improve on? We want to open the discussion to have as much input as possible. In the second step, we will give objective feedback. I might state, you are doing well on your OB rotation. Nursing commented to me that you seem to be doing well with communicating to patients and nursing alike. I might also give feedback on how they could improve their procedural skills. At the end of this, we will ask for learner understanding, asking them to summarize or rephrase what we discussed. Of course, this is not meant to be punitive, but to make sure we have a closed loop of communication. Finally, in making a plan for follow-up, we would want to ask the learner about their thoughts on ways to improve, and also make a plan for moving forward. This may be in agreeing to reconvene in 1 month's time, or perhaps an actionable item for that learner's improvement. The feedback process can be daunting for an advisor or for a learner. As in any large task, it starts with one item at a time, but also an agreed upon process. When we seem to have insurmountable tasks, going step by step can actually get us to the end product quite efficiently, although still with a few socks on the floor. We are with medical learners after all, and we are human. Thank you for watching, and thank you to faculty at Carolinas Medical Center, specifically Drs. Howley and Dr. McPherson, in providing the toolkit that is the basis for this faculty development.